Welcome to Nursing 342 Medical Surgical Conditions in Childhood. This is session 3 and we're discussing tumors in the newborn. Session overview. In this session, students will be introduced to some tumors that occur in the children. And the tumors to be discussed here include the Burkitts lymphoma and Retinablastoma, which affects the eye. Goals and objectives. At the end of the session, students will be able to define Burkitts lymphoma and Retinablastoma, identify the etiology of Burkitts lymphoma and retinoblastoma, and manage clients with Burkitts lymphoma and retinoblastoma. And once again, if you look at our chapter 26 of One's Essential of Pediatrics, you find some information, as well as when you use the University of Ghana databases, you will find some scholarly articles that discuss these conditions as well. So topic 1, we start with Burkitts lymphoma. Burkitts lymphoma is relatively rare and aggressive form of non-Hodgkin's lymphoma. Non-Hodgkin's lymphoma is a type of lymphoma of the lymphatic system. The lymphatic system helps our body to fight infection. So this is a picture of Burkitts lymphoma. So the incidence. Burkitts lymphoma is the most common in children, most common tumor in children living in sub-Saharan Africa. And on our part of the continent, Burkitts lymphoma is related to Epstein-Barr virus and chronic malaria. We'll discuss further how this happens. And Burkitts lymphoma is also seen elsewhere in other parts of the world where it is not related to Burkitts Epstein-Barr virus. Outside Africa, Burkitts lymphoma is most likely to occur in adults than in children and people who have immunosuppressed states, like patients with HIV. The etiology. The actual cause is not known. Risk factors vary according to geographical locations. In Africa, it is associated with Epstein-Barr virus and malaria infection, as I said earlier. And we are saying that it is also more common in children in Africa than in adults. And males are more affected than females. And also patients with HIV and other immunosuppression have this condition. And this is more common in northern parts of Africa, in the Middle East, in South America, in Papua New Guinea. The pathophysiology, how this occurs, is that in individuals in our part of the continent who have malaria, it is said or believed that it sort of potentiates the Epstein-Barr virus by preserving this virus, by preserving the virus that might have inoculated the beta or B lymphocytes. So when it immortalizes this by preserving it, it prevents it by the body's own way, suppresses the body's own way of destroying the beta lymphocytes, which is by self-drinking or eating, what we call apoptosis. And then when this happens, the B lymphocytes that have been infected by the Epstein-Barr virus now begins to proliferate and multiply more than normal, and therefore results in the cancer. Studies have also shown that when individuals with malaria have the B lymphocytes stimulation. The T lymphocytes, which allow the reactivation of this thing in the B cells, is also suppressed. And also, in immunodeficiency people with HIV, some drugs are responsible for the reactivation because the virus is, because the body's immunity is already suppressed. Then the Epstein-Barr virus now take advantage and colonizes and causes this infection. There are three main types of Burkitts lymphoma. And so we have the sporadic occurring in areas outside Africa, endemic occurring in Africa and parts of the world that malaria is endemic, and then also occurring in patients with some immunodeficiency. So it is characterized as immunodeficiency related. So when we come to the sporadic Burkitts lymphoma, we're saying that this occurs outside Africa, as I have said already, and you see that when it affects the individual, it attacks the lower abdomen, where the small intestines end and the large intestines begin. So this basically are some of, you see that the abdominal structures are mostly affected. And then in endemic areas like Africa and Ghana and other West African sub-regions near the equator, we see that this is strongly associated with malaria, and Epstein-Barr virus has been identified as a necessary cause. So in our parts of the world, it is also believed that Epstein-Barr virus is also a strong cause. And here it affects mainly the facial bones. You have the jaws, as you saw in the picture, affected, and the small intestines, the kidney, the ovaries, the breast, and other parts of the body may be involved. And in the immunosuppressed, as we said already, or immunodeficiency related Burkitts lymphoma, it is associated with HIV infection, and it prevents, so basically this is it. And then the clinical manifestations that this can cause, we have fever, we have weight loss, and in cases where you have sporadic Burkitts lymphoma, the abdominal swelling and pain or ascites may occur, intestinal obstruction, and other enlargement of the thyroid, as you can see displayed. Also, in the endemic, as we have in Africa, we said there is distortion of facial bones. The tumor grows rapidly and sometimes may increase faster. Is believed to be one of the fastest growing tumors that sort of replicates itself in less than 24 hours. And in the HIV, the symptoms are related to the HIV condition and is similar to those found in the sporadic regions. The diagnoses are found by the various examinations displayed. And another thing that goes to the diagnosis is staging, telling us about the degree of spread. So in stage 1, mostly it is localized. And when it comes to stage 2, there is some extranodular tumor that may affect nearby lymph nodes. And when it comes to stage 3, you can see it can be any of the things I have exhibited here. You may have 2 extranodal tumors on opposite sides of the diaphragm. The lymphoma originates in the lungs, so it spreads. So when it comes to stage 3, there is some degree of affecting nearby organs. And then in stage 4, it also is all that we have said in stage 3. In addition here, you see that the central nervous system, bones, so the spread now is very extensive. Treatment. We have said that like any other cancer, chemotherapy is used. Vincristine and other drugs listed here are all part of the drugs that can be used in chemotherapy. Also here, we're saying that there is a need for intense chemotherapy. So it can also, the chemotherapy can be given through the spinal fluid. That is the intrathecal method. Or the bone marrow transplant may be used, or stem cell transplant may be used. And then also in cases where there is abdominal obstruction, because in sporadic we said the abdominal organ is affected, abdominal surgery is conducted. Nursing management. This is related to the treatment regime. So you want to reduce rest, so you group all your nursing action and also measure daily bowel action in terms of regularity, so that you identify the occurrence of constipation early and you administer any antipyretic for fever, and then antiemetic may be given in cases where there is nausea and vomiting. So you treat according to symptoms. And because you have said that there is some degree of immunosuppression, there is a need to restrict visitors and also isolate the patient and not mix it up with other infectious conditions. And the immunization should not be given until children's immune system is matured enough, because it can develop into a full-blown condition. The prognosis, we are saying that it's often very bad or worse in adults, though treatment for adults has improved in recent years. It's more severe in adults. And then also in HIV/AIDS patients. However, children with Burkitts lymphoma in our part of the continent have best prognosis, because about 80% of the cases recover. So that brings us to the second topic, which is retinoblastoma. So you see that retinoblastoma is a tumor that affects the retina, and as you can see retina in the picture depicted, it is the light sensing structure in the eye. Retinoblastoma is congenital malignant tumor arising from the retina. It can be and it can also come over time in some growing children, but most common tumor is found in children. This is a picture of advanced tumor of the retina, and the retinoblastoma is commonly found in children. We are saying that this condition is rare. However, it does happen, and it's usually diagnosed before a child reaches the age of 3. Classifications. We have classified it according to whether it is 2 forms, whether it is hereditary or acquired or non-heritable. Approximately 55% of children with retinoblastoma acquired from environment. So in cases where you want to, this differentiation is made, it is elicited at family history or taking history. And in cases where there is no history of this condition in the family, then it is considered sporadic. The staging we have talked about, and we are saying that in cases where we talk about group 1, they're very favorable for saving, and therefore the outcome is good. And in stage 2, we say that it is doubtful because the lesion might have gone, might have progressed. However, it can be saved. But when it comes to stage 2 is favorable. However, from stage 3, 4, and beyond, inoculation or the removal of the eye may be necessary. And we have said here that it is either acquired or it is transmitted by mutation in the case of hereditary conditions. The signs and symptoms vary as you see. There is nystagmus and all that. And then there is also weight loss in advanced stages and fatigue. And so if you have this, as we said about leukorrhea, where there is abnormal appearance of the retina viewed through eye of the pupil, then this is how it appears. Diagnostic investigations are what we have seen here. And then the treatment, the medical treatment, we are saying here that the aim of our treatment is to preserve vision and minimize side effects and complications. Certain medications are used in retinoblastoma that are useful in preserving vision and also further spread of the tumor. And the drugs are the same drugs that we see most of the time in cancer patients, because this is a type of cancer. And also surgical management, where is indicated in diagnosis where there is unilateral or in stage 1, stage 2, stage 3. We are saying that we can do surgery, and also we have some radiotherapy to preserve the vision and also eradicate the tumor. And another is a laser photocoagulation, where the laser beam is used to destroy the vessel in the retina blood vessel that supplies the tumor with nutrition, and therefore cut off the growth and impede the spread. Cryotherapy is freezing of the tumor, and this is also done to reduce further spread. And chemotherapy involves application of heat directly. Usually infrared radiation is used in this to reduce the tumor. So the tumor also varies, but in advanced cases there is removal of the eye, enucleation of the eye, and this is mostly done in cases where only one eye is affected and is advanced. And in 95% of the cases, when this is done, it presents cure. So our nursing management is very key. We have to identify the signs and symptoms of retinoblastoma early. So we're saying that in cases where you see a child presenting with abnormal eye or cut eye, as we saw in the picture, is depicted, and something needs to be reported early. And also we need to prepare the patients and family towards therapeutic procedures and explain that there is help available and introduce them to various methods available so they can make an informed decision. And the parents must also know that whatever is done, especially after surgery, there will be normal facial appearance. And there is a need to provide emotional support by listening to them and involving them throughout the care. And here we are emphasizing on family-centered care, and we need to show pictures of children who have undergone the surgery to allay the anxiety before and after, so they will see what the possible outcome looks like, and also for them to know that the eye will be closed in cases where they need to. And also, after surgery, the eyelids usually are closed, as I said, and then when the transplant, the prosthesis is inserted, then the lower canter is usually covered with conjunctiva to look like the mucosal lining of the mouth, and then the eyes is open to look like normal. And this is usually within 3 weeks of therapy. Okay, initial structures for nursing care for the prosthesis are given by the eye specialist, and they also are involved in the care. Prostheses are cleansed and replaced, and it is by placing it in hot water and soaking it for several minutes so that it will make it very clean, and then the eye will remain very wet. And then explain to parents that prostheses are easily dislodged, it can be easily dislodged accidentally and should be reported for attention. And also it is important to know that Complications do occur if left untreated, and like any other cancer, once looking at the location of the eye, then it could spread to surrounding structures, including even the eye and all the bones surrounding the area. And there is also the likelihood of recurrence in cases where chemotherapy has been given. And child is also predisposed to other forms of cancers when there is spread. So for an assignment, which we are concluding this session with, you notice the following changes in Kofi, a 3-year-old boy, in your good news club. Change in color of the iris, the white spots of the iris. There's some white spots on the iris. There is nystagmus. The question is, what is the problem? And what will be your nursing management? Take time to answer this question. This brings us to the end of our session, and you have some references to look at. Have a good day and enjoy the rest of the day. Bye-bye.